Good evening, everyone. Welcome to our town hall event for fall 2020. This is our second town hall event since March, since COVID, and I think that this virtual world has afforded us a luxury of being able to bring together our subject matter experts from across the state and from other states as well, to provide us with some much needed information. I'm Jen Nielsen, the Executive Director of the South Carolina chapter, and I'll kick off tonight. I just wanted to give you a couple of housekeeping items. We'll be doing question and answer in between segments and then again at the end. Up on the top right-hand side of your Blue Jeans menu, you'll see a chat function. You can enter all of your questions in there at any time. Excuse me. To get things kicked off tonight, I just wanted to tell you guys a little bit about our virtual plans for the fall. Slide, please. There we are. As everyone may or may not know, all of our events for fall of 2020 have gone virtual. So that includes our rescheduled Great Strides, our cycling event, Finest All-Stars. We've gotten very creative in the past couple of months, putting together some pretty great programs for our community in the fall. We have currently running a 65 Roses challenge. I'm sure if you know Great Strides or cycle at all, you've heard from our team about what that looks like. We also, if you follow us on social media, you've noticed that we have a Minute to Win It challenge going with some of our CF community, and those are really fun videos if you want to check those out. We took a different approach to our Finest campaigns this year, and we brought back 10 years of alumni of that Finest program to work with us on an All-Stars campaign, and that kicked off a few weeks ago, and they are raring to go and already have raised almost $15,000, so we're pretty excited about that. That will culminate in a finale event in October. In September, we have our National BreatheCon event that's open to members of the CF community 18 and over. This is the 5th BreatheCon that's happened, and registration links can be found on our website locally and also on cff.org. Next slide. This just gives you a little visual of each of the events that is happening. Oh, and I almost forgot, we are kicking off a Grampians program in the state of South Carolina on August 27th. So if you have any grandparents or aunts, uncles in your circle that you would like to have involved with that program, just give us a shout either on social media or via email. Next slide, please. Quick agenda, I'll go through and then we'll turn it over to our speakers. Opening tonight, we have Erin Stocks, who's our operation manager in the Compass program. Then we have Dr. St. Petery from MUSC Children's, Dr. Staples from Prisma Children's, and Dr. Flume from MUSC. We switched the order around a little bit to give the experts some more time, so I'll just close it out with any questions and answers. So I'm going to turn it over to Erin. Erin, I think you're unmuted now.
Yeah, it looks that way. I apologize, Jen. The camera is not allowing me to turn that on. So this weekend I can give some updates verbally and go through a couple of things that we wanted to share. I'm Aaron. I'm one of the operations managers, the Compass program. For anyone that is not familiar with what Compass is, it's a free and confidential service that's provided by the CF Foundation to help with navigating insurance, any financial burdens that you may be facing, or other challenges that you might be running into. And I can go into those in just a moment. We wanted to take an opportunity with you to share some of the details and trends that we're seeing in phone calls related to the pandemic for a couple of different reasons. We first wanted to let you know that we are listening to the challenges that our community is facing throughout the country and aggressively strategizing for ways that we might be able to help from a larger perspective. And secondly, to let you know that our case managers at Compass are here. They're here for you now more than ever. So hopefully you can see the chart here in the first slide. Obviously, just like the rest of the world, back in March, we started getting phone calls about safety precautions. You know, is it safe for my child to go to school, to even be out in public? And then we kind of transitioned to questions about, you know, what types of supplies, masks and hand sanitizers, where to get these types of supplies. Obviously, people wanted to protect themselves. And then as we started to transition into April and May, we were running into challenges and questions about work accommodations. There were people who were being laid off from their job, or they're making a very difficult decision about whether or not they wanted to go to work. And then obviously, you know, with those challenges, we lead into financial hardships and looking for resources that can help with, you know, very basic living needs. And now we're moving into July and August, and we're getting lots of questions about telehealth, right? We want to make sure that people with CF are having access to their care teams. And then now, obviously, school accommodations. You know, whether it's you know, looking for resources for homeschooling because you don't think it's safe to go back to school. You know, parents who are teachers, you know, they're afraid to go back to school. So we are constantly monitoring the types of questions and calls that we're getting and sharing around the foundation so that we can strategize to come up with guidance and answers to a lot of these tough questions. And as to date, we've received over 620 phone calls just related to the pandemic. Next slide, please. But we always felt like it's a great way just to give a couple of examples of just how Compass can help. So a few examples of we've received multiple phone calls from individuals and families who either could no longer work or there's a significant change in household income, and unfortunately, you know, families were having a hard time affording food or paying for their rent or mortgage and utilities. So we have been able to find resources out there, whether it be within their local community, within the state. There are lots of CF-specific organizations that have been able to help financially. We found some organizations out there that have been able to provide gift cards for food or some other basic living needs. And then we're also finding legal resources for folks who have unfortunately lost their job, or what if hours get cut back. And you now have to work part-time instead of full-time. And for some people, that means losing their income. CF community, we know that it's incredibly important to have good coverage. So these are a couple of examples that we're seeing in the CF community, but that's not limited to some of the things that we can help with. So whether you are having challenges that are related or unrelated to the pandemic, we are here with you. Feel free to give us a call, and our case manager is here to help and answer your questions and look for resources.
Thanks, Aaron. And we don't have any questions in the chat box now, but I'm sure by the end of the presentations, we will have some questions for you.
Great.
Now I would like to welcome Dr. St. Petery from MUSC Children's. And I think I have to unmute you. There we are.
Thank you so much, Jen. So I wanted to focus today on kind of the elephant in the room within our local and national community, which is going back to school in the midst of the coronavirus pandemic. And so we'll touch both on some logistics and strategies that you can take in regards to the decision making about going back to school, as well as some tools to help with that transition, particularly with guidance from our team psychologist, Dr. Kristen. Next slide, please. So to give you a little roadmap of what we'll be covering, I'll discuss the most recent South Carolina COVID-19 data, give a brief review of the data from the CF Foundation Patient Registry, and how that reflects some decision making that you might want to consider. And then the sort of main questions about CF and school. Is it safe? What considerations should I make? Who should I talk to? What resources are available to me and to my child? What if it's the sibling of my child who has cystic fibrosis, or perhaps if I, as an adult, have cystic fibrosis? What should my game plan be in those scenarios? And so to break those down into the planning phase, and then also remembering resources that we can help connect you with, both as individual care teams and providers, as well as the greater CF community. Next slide, please. So to give you a bird's eye view in regards to testing, as of yesterday afternoon at the close of business, we had done just under 800,000 total tests looking for COVID-19 positivity in patients across South Carolina. The vast majority of this is viral or PCR testing, looking for active infection as opposed to antibody tests, which help to determine if someone has had COVID-19 in the past and has since recovered. We know that there are around 94,000 known cases, and that in the past 14 days, about 20,000 cases have been diagnosed. This gives us about a breakdown of just under 2,000 cases per 100,000. And recently in the Charleston area, we've been seeing positivity rates in regards to testing of between 15 and 20%. Those are all things to keep in mind as you're making decisions about going back to school. As in different communities, the frequency of infection and cases being diagnosed and saturation of the healthcare system may differ quite a bit. So definitely look to your local resources for updated numbers on your county and the areas where you attend school. Next slide, please. So some additional information to consider is how much are the patients who are being diagnosed with COVID-19 impacting our healthcare system? How many of them are being hospitalized? So currently there are just under 1,500 patients admitted with COVID-19 in the state of South Carolina. 355 are in the ICU, and that includes both pediatric and adult ICU patients. 254 of those ICU patients are intubated or have a breathing tube that's helping them to provide oxygen and breathe off CO2. There are over 1,100 ICU beds occupied, which is roughly 80% of the capacity within the state of South Carolina, and that leaves 321 ICU beds available. And again, these are both ICU beds within adult and pediatric ICUs. If you're not aware, there are some ICUs that are housing both adult and pediatric patients, and so in some cases it's very helpful to think of them as a whole unit in terms of number of available beds. And in regards to deaths, we know that there have been 1,774 related to COVID-19 in the state of South Carolina. Next slide, please. When we take that information about COVID-19 in our population and try to translate that to the experience with CF, we have some very helpful information from the CF Patient Registry. So we know that there are frequently tests being done for patients who have COVID symptoms, and that means that roughly about 2,600 tests for COVID-19 have been conducted among 2,138 unique patients. We know that only 122 of those resulted in a positive result, 83 adults and 39 pediatric positive cases, and that of those positive cases, only 33 have been hospitalized, so a minority, which is reassuring. Of those hospitalized, 7 were pediatric patients, and of those who were diagnosed, 18 were with advanced lung disease or an FEV1 that was in the lower range. Patients with lung transplant have also been included, and 5 of those have been diagnosed with a single death each in the lung transplant group and advanced lung disease group. And overall, I would say that the takeaway from this CF-specific data is that folks who have been infected with COVID-19 and are recovering, that the course has generally been better than we anticipated in regards to frequency of hospitalization and worrisome outcomes. Not to say that a more significant complication isn't possible, but overall the numbers are more encouraging than we had anticipated going into the pandemic in March. Next slide, please. So what about children? The main transition in many of our communities over the next few weeks with the return to school really focuses primarily on children and how children interact with their environment and the teachers that they will be potentially interacting with in person. The density of children in relationship to teachers is typically higher, so a larger proportion of students relative to teachers. And so it's important to look at the information we have on whether infection might be different for children in different age groups or for children compared to adults. There has been some misinformation that I've seen in various avenues on social media about how children can't pass on coronavirus or that children may not infect other adults. We know that transmission rates are lower in children, particularly those under the age of 10, but we do know that transmission is possible. For those who are older than age 10, we expect that transmission is more or less equivalent to that with adults. So we would treat those older age groups of children in the latter portions of elementary school and in middle and high school as having the same potential risk of a group of adults gathering, regardless of the fact that they're developmentally and physically not adults. We do also know that hospitalization rates are lower in children, but we also know that complications can be severe. One particular diagnosis that we've seen more frequently in children with a report of about 350 cases nationwide is an inflammatory condition that you may have read about in the newspaper or on the internet. And that is a process that is specific to children and can have some quite severe symptoms and typically results in hospitalization. So that is one condition to be aware of. And we also know that in general, chronic health conditions do increase risk of serious illness with COVID-19. While we have relatively reassuring data from the CF patient registry on the frequency of illness and the rates of severe or worrisome outcomes in patients with cystic fibrosis, we certainly still know that those worrisome outcomes are possible and to keep that in mind. Of course, there is much evolving in the diagnosis and treatment for COVID-19, so there's a lot to learn in terms of how to approach it, how we move forward in becoming successful in conquering this pandemic. Next slide, please. So the school question. What to consider with either my child with CF going to school or daycare, or perhaps they have siblings who do not have cystic fibrosis that you're considering sending to school, or perhaps the person in the household with cystic fibrosis is one of the caregivers or adults, and the children do not have cystic fibrosis. What things should I consider? Should my child go back to school or to daycare? What we know is that remote learning remains the safest option to avoid COVID-19 exposure, whether your child, siblings, or caregivers are the ones who have cystic fibrosis or any other chronic health condition. We also know that there are many factors that go into decision-making in regarding school choice, and those are not exhaustive, but include things like resources available at your school. So what are the potential options being offered to you and your family in regards to your child returning to school? Is distance learning the only option? Are there technologies that are being made available to your child? Are there physical resources that are being given out? So things like laptop computers or tablets. What's the internet connection like where you live? Are there resources that your child can only access in person because of particular diagnoses? So do they receive special therapies in the school environment like speech therapy or occupational therapy? And how do those fit in with the potential options for learning for your child? What are the resources in your community? What is the COVID status? So are case rates increasing or decreasing? Is there more uptick in cases versus have things plateaued? What are the resources like in your family? So what are the number of caregivers, whether that's in the household or friends, neighbors, relatives? What's the employment situation for caregivers? Is there going to be a challenge in balancing the combination of distance learning and working from home? What are the family's schedules? Does someone work perhaps in the evenings or in a shift that doesn't mesh well with student learning and needing to sleep during the day? And then, of course, are there student-specific factors? Are there social factors or emotional supports that your child has access to in an in-person school environment that they simply do not have if they're learning from a distance standpoint? So all of those things should be considered and make up the individual decision-making that you and your family should consider when taking the approach to different choices in learning. But we also want to advocate that the potential for distance learning should be available for all people in households with health risks from attending school or being in a school environment, whether that's the patient, siblings, or caregivers. So we'll go on to talk more about resources and ways to navigate these choices more specifically. Next slide, please. So how to prepare. For most folks, at least in South Carolina, we hopefully have at least a couple of weeks to really fine-tune decision-making and update ourselves as to the most specifics that our schools are using in their planning for the school year. We know that there's a push to return to normal and that many emotions may change, but that each family needs to make a decision that's best for their unique circumstances and their community. Next slide, please. Risk. How can I reduce risk for my child, assuming that they are going to be spending some time in the classroom, whether that's 2 days a week or 5 days a week? We know that physical distance is extremely helpful in reducing risk of infection from one person to another. So thinking about desk chairs, how classrooms are set up physically, what are common areas going to look like in terms of meal time, times to stretch our legs, and if there's going to be recess, depending on the age of your child. What will the school's policy be on face masks? It's age appropriate for children in elementary school and up to wear a face mask. But realistically, what's the likelihood that your child who just turned 6 will wear their face mask during the entirety of the school day? It's important to think about those both in the classroom and then for the children around your student. Perhaps your child has become an expert in wearing a mask, but the other 6 to 7-year-olds in your child's classroom perhaps might not have that same expertise. Is hand washing available, whether alcohol or soap and water? Both of those are acceptable options. What will the policies be in the classroom, and will that be offered and at what intervals and in what situations? Will large gatherings be avoided? So how will things like transitioning between classrooms be approached, or recess, school assemblies? Will those be virtual? How will the different parts of the school day be considered in regards to reducing risk from gatherings of groups? There's some information in the link below on how to protect yourself and others generally that are well applicable to the school environment. And so if you need more information, please check that out or circle back with one of us or your care team. Next slide, please. Prevention. So if you're considering school attendance, definitely talk directly with your child's school about their infection prevention policies. There are a number of different topics that could come up in that discussion, but definitely consider things like what the size of the student's class will be, so how many children will be in each room, and what is the general layout and size of the classroom. Will children be cohorted or in staggered schedules, so that if students 1 through 50 out of, say, 100 students are attending school on Monday and Tuesday, that they don't end up being mixed up with the students 51 through 100 in that example cohort of students, so that it might become more difficult to determine if there's been an exposure if someone does fall ill. What are the cleaning and disinfection protocols going to be in different areas of the school, whether that's the classroom itself or bathrooms? How will your student get to school, and how will other students get to school? What will the policies be on things like buses or in shared vehicles for school? How will different objects be handled in the classroom? So learning aids or objects that might be shared between students, how will those be disinfected, or will they be used at all? How will your students' belongings be attended to, and will those be separated on an individual basis, and how will those be organized in the space? Ventilation with things like opening windows and doors, food service, so for students who could bring their own lunch, is that an option? For students who depend upon school provided lunch, how will that be served? How will events in the school or the need to self-isolate or remain home be communicated throughout the school community? Will there be an email list, phone calls? It's important to clarify these things before the school year starts. And then, of course, in the unfortunate situation that your child does become sick with any symptoms that either could be consistent with COVID-19 or something else entirely, what are the policies of the school in regards to your child returning, and what testing that they may require? So important to review those potential points with your school, and if you need additional organization of kind of how to approach that topic, there's some helpful guidelines from the CDC resource at the bottom of the page. Next slide, please. College. So college is a very similar environment to elementary, middle, and high schools, but does provide some more unique and challenging situations. The vast majority of colleges that I've been reading about and hearing about from families are offering distance learning options, but if by chance they are not, that is something to discuss with the university staff and think about things like deferment or interacting with Compass Legal Services to help advocate for your student in regards to the potential accommodations that should be made related to their cystic fibrosis diagnosis. So of course, colleges and universities will be taking precautions very similar to other school environments, but the unique situations on a college campus, such as dormitories and shared living spaces, dining halls, and then the transition to adulthood, socialization, extracurriculars, all of those things are things to consider and to understand how your student school will be approaching as the beginning of the school year starts. Next slide, please. So resources. Of course, remember that your CF Care team is a resource and advocate for you and your family and the greater CF community at large. As we've already heard from our Compass colleagues, also lean heavily on them if there are legal concerns that you have. It's likely that a question that you have has come up before and that there are situations or resources that you can be connected with to help with those specific questions. Definitely consider having an individualized education plan or 504 plan for your child if you don't already, and talk to your care team or your Compass case manager to help better identify planning for those two different choices as the school year approaches. Next slide, please. So the latter portion of my slides are from Dr. Kristen, and they focus on stress and COVID-19. So we know just from the dynamics of the past 4 to 5 months with things being rapidly changing, that COVID-19 has certainly led to many unprecedented, unpredictable changes that affect us in many ways. These are physical changes, emotional changes, economic, social, psychological. They really run the gamut. And the challenges come across in many different environments. Our routines change day to day, how we interact with our community, how we aren't able to access different activities that we've leaned on in prior situations, how situations that we previously felt very comfortable with, we can no longer control. Of course, work or financial challenges, and then the big question mark of not knowing when life, whether in your household or in your school or work environment, will return to what you remember as being normal. And uncertainty is a very uncomfortable experience for all of us. So it's a very normal, natural response in these sort of crises to have anxiety and worry pop up. And so in particular for folks with cystic fibrosis and their families, this pandemic is likely amplifying some existing or past stress in regards to the connection to a chronic illness. Next slide, please. So again, this new phase of transition, things opening up, sports, school, social events, taking these decisions as individuals in regards to your family and having shared decision making is an ideal approach to take, particularly with as much data as you can to help inform those decisions. Next slide, please. How to support your child's mental health as they return to school. So how to put them with their best foot forward when that day one hits. Definitely talk about return to school before that first day comes. I know that that shift in routine and schedule can definitely be a difficult one after having many months of being primarily at home. Things like your day-to-day routine will change, sleep routine will change. When they actually do make it to school, there will likely be dramatic differences from what they may have remembered if they've attended school in the past. So things like recess and extracurriculars will likely not be at all what they remember, and the joy that they took in those things may not be as robust as it was in the past. There are likely going to be new procedures for social distancing and safety that they will need to adjust to, and that if they are not returning to school, that this may lead to feelings of isolation or even sadness. Bullying still can occur in school, whether that's in person or virtually, and that there will be stress and additional burdens on folks around them. So parents and caregivers also adapting to the dynamic environment of returning to school and work in the midst of a pandemic. Next slide, please. So tips, how to really tackle things and be as prepared as you can. Get to know what your school is doing, like we discussed a few moments ago. For virtual learning, think about how to stay connected socially. What opportunities exist to keep your child engaged while still being safe at home? For those in school, what to expect about preventative measures. When you talk about it with your school's representatives, bring that information back to your children and to your family as a whole so that everyone understands what the new routine will look like and there are no surprises on day one. Practice your new school routine in anticipation of that first day. Get up at your regular wake time, go to bed at your regular bedtime, lay out the things that you need, masks, hand sanitizer, wipes, whatever you plan to send your child with, lunch boxes, help get them oriented to those different tools. Check in regularly with your child about how they're coping, look for behavioral changes, and then if things pop up, which is very reasonable to expect that they may, listen and help to problem solve together with your child, since their concerns can certainly be very valid during all of these changes and new activities that they're experiencing. Next slide, please. So additional tips for parents and caregivers. It's helpful if you can to manage your own stress and emotions. I know I personally have both of these things considering the upcoming school year, and I don't have any children myself. But knowing that our community will be in transition, it's important to acknowledge that we as adults have these feelings and that there are ways to optimally address and express them. model good emotional expression and coping, since children really model what they see those around them doing. Be prepared, try to be calm if you can, and be confident in the information that you've gathered. Focus on the positives, regardless of what decision that you make, in person or virtual. And then definitely make an effort to also consider things like self-care, wellness, and mental health in the wins that you're achieving on a day-to-day basis. School achievement is, of course, incredibly important, but it's not every year that you're starting school or even ending the school year during a pandemic. And so maintaining some of those day-to-day activities should also be applauded. And then be creative about maintaining social connection. Maybe think about scheduling virtual play dates or phone calls and maintaining some of the connections that you've been working so hard to keep going over the summer months while still social distancing. Next slide, please. For those of you who are parents juggling not only being an employee, but also a teacher for your child or children, doing your job and being a parent, know that this is an incredibly difficult task and you are doing the very best that you can. The phrase that I've been repeating frequently lately is, all we can do is what we can do. And that is truly it and nothing more. So try to be realistic, be flexible, and be prepared when you can. But if not, just know that take a deep breath, model those positive behaviors for your kiddos, and try to tackle it as best you can. And know that you have resources to help you when challenges do come up. Next slide, please. So how to balance the challenge of both remote learning and working from home. Try to carve time out for yourself before children wake. I know this is a terrible proposition for some folks, but it can feel really satisfying to have time to cross things off your to-do list and feel like you're making forward progress. Set up time devoted to your work. If there's the ability to balance that with another person in your household, take shifts or block time if possible. If you're a single parent, try to ask for other folks in your community to help, whether that's in person or remotely. You can certainly have other family members call in and do a book reading session with your children or help guide them during a lesson that they're doing from school. So definitely lean into those resources as well. Give everyone a zone in the household if that's possible, and promote each person sticking with their zone during their dedicated work times. Join together during parts of the day where you can and establish new family routines like lunches together or special meals on certain days. Next slide, please. So additional tips. Think about ways for children to best communicate with you during the workday if something does come up, whether that's texting or emails, if your child uses email, using signs or some other signal system. Discuss that before the first day of school starts as well. Have a schedule and try to stick to it as best you can. And if there are tools in your house, like using alarms or Amazon Alexa to keep the family on track, embrace using those tools as well. Give children tasks for if they finish their work before you do. Things like a sticker chart and giving them goals for the week can really help to balance some of the demands of the household work and also giving children the empowerment to feel that they're accomplishing things to help keep the house moving in a positive direction. Rewards can be something from as simple as a sticker to getting to select the movie for family movie night, or maybe even a special treat that you have them working towards over a longer period of time. And then encourage autonomy. Children can help establish daily goals and divide up what they think that they can accomplish. This can really help with independence skills and giving them additional abilities to manage tasks on their own in the home safely without adult support 100% of the time. Next slide, please. Some additional resources from NPR, the Washington Post, and Connections Academy. You can peruse those later on if you'd like. And then next are some additional resources that are more books and handbooks. So these are all free resources, and you should be able to access either by searching or through the links below. So there's a family guidebook with coping and skill activities. And then next there are some pediatric focused tools. The Moodsters, a first aid book for children. Next slide, please. The Covey book, which is a short book providing focus on reassurance, particularly for children under the age of 7. Trinka and Sam, which is more a story about community, also geared towards younger children. My Hero Is You, which is an excellent book that you can read together with children ages 6 to 11. It is definitely geared towards tandem reading, so set time aside to either do this Zoom call or as a group with your family, or maybe even as an activity in your child's classroom. This would be a great resource to mention if your child is going to be attending school in the next few days. And then for teens and young adults, there's the Coping with COVID-19 workbook, COVID-19 anxiety workshop. And then the next slide has resources for adults, the coronavirus anxiety workbook, and the Face COVID workbook. So just one final reminder, if at any time you're concerned about your emotional wellness or your child's, please reach out for help. There are many mental health providers who are providing services remotely through telemedicine or by phone, and more resources are becoming available. So please touch base with us at your CF Care centers and really just try to feel as empowered as you can in your decision making by attending sessions like these and gathering information on moving forward in a positive direction with your child and school year and work. It's gathering as much information as you possibly can to really have the best foot forward as you're embarking on the new transition into the fall winter season, school, and the changing dynamic of our communities. So kudos to you for listening to my long talk, and I welcome any questions that you have.
Thank you, Dr. Sampetery. I had a question come in earlier that I was asked to ask. I have a mom that can't make it tonight, and they were wondering your thoughts on recreational sports, school sports, for the 11 to 12-year-old range. I personally know this child plays baseball, so they're asking questions about basically school sports, and if your child is with CF is attending, or rec sports, if you would recommend them playing this season.
So I think that is another decision to make on an individual family basis. We, of course, know that exercise is extremely helpful for maintaining lung function in cystic fibrosis, and it's also a wonderful tool for preserving mental health, relieving stress, building community. There are so many wonderful things about exercise, and team sports, in addition to that, have the wonderful addition of being a more tight-knit community, getting to know peers, building individual skills and teamwork skills. So there are many wonderful things that come with team sports and the tools that are used in building a team. What I would tell individual parents and really anyone who's considering team sports is to talk to the coaches about what their plan is for how to keep the sports strategies as safe as possible. Will sports be offered sort of in the formal sense? Will there be games? Will it simply be conditioning? Is there an option for a student to maybe get the recommendations for what they should be doing in terms of exercises or conditioning strategies, and do them more on an individual basis if they don't feel comfortable working in a group setting, whether that's in a gym with the doors open, outdoors? There are going to be very many factors that vary between different teams, sports clubs, and so I think I would ask what the specifics are for each environment. We know that in general, it's much safer to exercise with as little physical contact between individuals, and so baseball is a sport where mostly folks are standing independently from one another. But there are other situations where you're trying to steal home. I'm not sure if that's the right terminology. I'm not a big baseball player.
It is.
But if you're getting in close physical proximity to someone, think about how to make that as safe as possible. Maybe there could be some other alternatives to those close contact scenarios, or maybe just focusing on conditioning where you get a lot of those same physical benefits without some of the potential risk from being in close contact.
Wonderful. Thank you.
Absolutely.
Okay, I'm gonna thank you very much for all of that information. Now we're gonna welcome Dr. Heather Staples from Prisma Children's. I unmuted you.
Awesome. All right, thank you so much, Jen. So I just have a brief update from the Midlands. I wanted to give you guys some insight of some things going on there and some potential resources that we have. You can go on to the next slide. So just an update that I know we're doing and all the other centers in the state are doing is kind of some increased infection control measures. In a lot of our clinics, you'll see that not only we're wearing masks, but many of us are wearing eye gear. And that is just for the protection of everybody in clinic, all the visitors in clinic, and the staff. So in the Midlands in particular, we have been able to go ahead and move forward with PFTs, which have not occurred at all centers, but we've had some infection control oversight that has given us the go-ahead to do mobile spirometry in the patient rooms. So good news is if you missed a visit earlier this spring and weren't able to get spirometry, we'll be able to do that for you at your next visit. Next slide. The one thing I did want to bring up is that, you know, with some of the missed visits in the spring, there were some delay in obtaining annual labs and chest x-rays as well as quarterly labs for patients who are on Trikafta or Cambia and so on. And I just want to encourage you, if you missed your typical time that you would get your annual labs and x-ray, to reach out to your CF center and make sure that that is still on the radar. A lot of the local labs, particularly our lab at the Children's Hospital, has a lot of strong safety measures in place. We do feel comfortable sending our patients to get these labs drawn. So I just want to encourage you, if you know you're behind on some of these things, to reach out to your care center to find out if your particular area, if they're ready for you to get back on track with these labs. Next slide. At our last town hall, I gave you guys a little sneak peek into what we were doing at the start of the pandemic when we had kind of closed down for regular CF quarterly visits. We utilized a mobile health unit with the van that you can see here, or truck, however you want to call it, where we were able to travel to patients' homes and set up and do on-site visits with the patients. There was a lot of interest garnered from that, particularly from our center. And I did want to let you know where things stand with the mobile health unit. So next slide. So we were able to see about 50% of our entire CF population in the Midlands between April and June. It was a very successful outing, and I feel like it really met the need at the time for our patients. Right now, we're not moving forward with any current upcoming dates. One, with the heat, it's very difficult to do these outside visits. It's starting to get quite uncomfortable, but also we're finding that people are becoming more and more comfortable coming into the clinic just because of all of our new infection control procedures. The one thing we've discussed is the potential to utilize the mobile health unit again this fall if we're having a lot of issues when we see an uptick in the flu as well as a potential uptick in the COVID cases. So we will be following the foundation's recommendations closely as far as safety for coming to clinic, with the possibility that we may utilize the mobile health unit later this year. Next slide. The one resource that I did want to mention, and as of right now, this is limited to the Midlands area, but that's through the University of South Carolina School of Law in the partnership they have with Prisma Health, and in particular the Department of Pediatrics. And that's the CHAMPS program. Next slide. So it's a medical legal partnership and actually utilizes the law students that are there at the law school to help address issues with lower income children and families with a myriad of needs that may impact their health and healthcare. And they can be referred to this program from any provider that's with Prisma Health in the Midlands. Next slide. So CHAMPS is really focused on dealing with social determinants of health, so anything related to housing, Medicaid, SSI. And the one thing that is kind of been the forthcoming issue that we've been discussing is the utilization of CHAMPS with employment issues related to school and the pandemic. Next slide. So if you feel that you may have an interest in this program because of a concern that you have with employment issues related to your children going back to school or needing to work from home so that you can help with your children's virtual school, and you think you may qualify for the CHAMPS program, I just wanted to make you aware that this existed. And if you are interested in it, to reach out to one of us at the Midlands CF Center to get you hooked up with the CHAMPS program. Next slide. All right.
Thank you, Dr. Staples.
Yeah, my pleasure.
And we don't have any questions right now, so I'll just keep that open until the end. And now I'd like to welcome Dr. Patrick Flume of MUSC. Dr. Flume?
Thank you. Well, I have a few things to say about clinical research. I'll first start with CF-related research. When the COVID situation hit, every center rapidly shut down their clinical trials. And so ongoing studies actually had very delayed, slowed enrollment. And some sponsors didn't want any patients enrolled in those studies at all. We were very fortunate that there were a number of studies which had come to their conclusions. So we actually will have some data later this year. For example, our STOP2 study, which is testing durations of IV antibiotics for treatment of pulmonary exacerbations, that study ended at the end of January. And so those results will be made available at the North American CF meeting. So we're very excited about those results. But other studies like inhaled nitric oxide, inhaled vancomycin as treatments for chronic infection completed their enrollment and are at least finishing up their visits and analysis, so those data will be forthcoming. The modulator studies, the triple in 6 to 11 and then 2 to 5 have been marching on. They've not been as rapid as the previous Vertex studies, but I anticipate they will be finishing. So those will be marching on, and there will be more studies coming forward, just being careful about enrollment. I just wanted to mention a few things about our shift to deal with the COVID situation. Obviously, just like in the clinics, we had to shift the research environment to a remote research capability. And that will be something that will continue. So for some of these study designs in the future, they're going to have to create platforms in which those patients can be studied with more visits at home. But I wanted to talk about the way we've attacked the COVID-19 studies, and we can go to the next slide. I have looked at over 250 studies related to COVID, as everybody was looking for whether their drug might have potential either for prevention of infection, treatment of the virus, or prevention of the complications of a viral infection. And our approach has been to focus on the virus and with a platform of trying to address those who are the sickest. And so what you can see here is the spectrum of disease from patients who do not have COVID, ranging from healthy individuals to those who are exposed to the virus, to those who actually have become infected by COVID, but some that are healthier in the outpatient setting, or those that get hospitalized and may have mild to moderate or even severe disease. Very early on, we knew that we would need to have information about these patients, so we created what's called a biorepository, in which we are collecting clinical specimens from people who are infected with COVID that we can then use to try to discover new therapies or understand the pathology of disease. And so people who have been infected have volunteered to donate blood or saliva. We have their nasal swabs, and we have investigators with interesting questions to try to understand this disease better. The convalescent plasma program, this is essentially using antibodies that are made by people who had and survived COVID and infusing that, is giving a transfusion of that plasma to people who are actively sick. And so when this was launched at MUSC as part of a large nationwide program, we sort of anticipated that we would end up treating about 20 or 30 patients, and we currently have treated over 250 patients across the state, and we're hoping there'll be data coming out soon. Obviously, it's a therapy that patients are very interested in. For people who are sick, when you see things like tocilizumab and ravulizumab, these are antibodies blocking the inflammatory pathway in different ways. So these don't do anything about the virus themselves. These are actually trying to prevent complications as a severity of disease. So the therapies that we have, which are targeting the virus, these are the Regeneron studies, the Active One platform, and ATIA. So ATIA is an antiviral drug, somewhat like remdesivir, which has been approved for treatment of the virus. It's not the same, but that's the approach it is trying to prevent the virus from getting in. The Regeneron is looking at a couple of monoclonal antibodies that are given to subjects to try to prevent uptake of the virus. And so our current study is treating those patients newly infected or diagnosed, but still not super sick. So they're in the outpatient setting. And then we are launching a study to treat their roommates, their housemates. So if someone were to become infected, to try to prevent infection in their family members, we could give them the antibody. And the exciting thing about this particular product is a paper came out just yesterday showing success in 2 other animal models. So we have some hope for that. But the big studies that we're pushing for are the vaccines, and so we are ramping up a vaccine study that I hope we will have up and running in the next week or two, using the vaccine developed out of Oxford, in which we'll be dosing adults. This will be a very, very large study, looking to try to prevent either acquiring the disease or serious disease. And so we believe that products like Regeneron antibodies might be a way to try to prevent progression, but we ultimately need to get towards a vaccine. So that's, we're very excited about that. So I will stop there and entertain any questions.
Thank you, Dr. Flum. I don't have any questions in the chat, but again, this presentation has been recorded, so we'll be sharing this out with different groups. And just for me, this last part was so incredible because I just love to know about all of the different clinical trials and research that are happening literally in our backyard. So it's very cool. Thank you very much for your time tonight. Next slide, please. If you guys would take a minute before you sign off tonight and just let us know a little bit about, your experience tonight with the town hall. We're trying out a new tech product called Menti, and you would just go on your phone to menti.com and type in this code, and there's 3 or 4 questions that we would love to have you answer. But thank you so much to all of the presenters this evening, and thank you to all of those who have joined us, and we appreciate any feedback and any additional information that you would like to share. Thanks, everyone.